With me today is Dr. Rounazoin, Curt,
Yes.
who has long been one of my role models in the field of EMDR therapy. When I first got trained in the early 2000s, his was some of the teaching that was really highlighted on working with dissociation, and I've cited the paper Curtis and Rounazoin 2002 many times.
Thank you.
That was clarifying a lot of the misconceptions that were out there.
That's correct.
About EMDR at the time. So how did EMDR meet you? What was the story?
It met me reluctantly.
Okay.
I'd gone through a very scientific oriented PhD program where evidence-based treatments were one of the first places it was introduced, and we
Sure.
were schooled in. And so when this crazy thing with hand movements and all this came up, one of my social workers said, "You need to go and try this," and I thought she was crazy.
Mm-hmm.
And the mistake I made was I went to Francine's training.
Okay.
And I stayed in the practicum, and in that practicum experience, I had experience with something that happened to me when I was a kid, getting jumped by other kids. And I had a remarkable physiological shift as a result of that, and I had never experienced that. So the scientist part of me said, this is something I don't understand, so I need to study it. And that was in '91,
Yeah.
so I've been involved since then.
Very close to the beginning.
Yeah.
And I've heard a similar tale from a lot of folks like you in those early days who
Yes.
initially wrote it off as
Voodoo.
what?
This is
Yeah.
crazy.
And so it sounds like the experience you had with it.
The experience, and Francine Shapiro always involved the experience part, because, and in my trainings I do, one of the things that I say is that, part of what you do is you must hopefully experience EMDR therapy as a therapist, that you know what it feels like to be on the other side of the couch.
And I often don't know how I would have reacted because EMDR came into my life as a client.
Yes.
I got the card saying, go see this person who does the weird stuff, because I was so resistant to do any other kind of counseling because I felt I knew all the answers to the CBT bubble dots. And
Yes.
yeah, and having that experience, I know it sounds corny, changed my life,
Yeah.
but it's what happened. And I said, I have to learn this and share it with others.
Very common, and if the clinician would allow him or herself the freedom to do that. See, as a client, you went in and you got help. As you know, working with mental health professionals, they're some of the hardest people to teach because they
Yes.
think their paradigms, make the world work.
Right.
And part of what we do in our trainings, of course, is help them alter those paradigms.
So tell us about dissociation and how that became an area of interest for you.
Again, reluctantly.
Okay.
As I tell people, a lot of us that are working in dissociation didn't go in and say, I'm going to really focus on the dissociative process. But what we do is we define patients and they're dissociating. And we began to realize what's going on. As you know, for a long time, dissociative process in therapy has been viewed as resistance.
Yes.
And if you understand that dissociation is a survival skill, necessary and organic, that you utilize it. And so I was on a pre-doc internship in a child guidance center. And I was introduced to a 16-year-old girl who came in one day as, I'll use the word Mary, delightful cheerleader type, blonde hair, green eyes. And I was excited to see her the next week. The next week she came in as Cliff. Changed my perspective single-handedly. And then fortunately, someone at the Child Guidance Center at that time was an expert in dissociative disorders, had done stuff with Colin Ross. And I became one of her supervisees and worked with her. And that was in 1980, and I was been involved in it since, long before EMDR came along.
Right.
Yeah.
I remember the role you played for us, so I did not directly train with you early on, but Amber, my colleague who's with me in the program, did. And I remember when she came back from her basic, she said, I heard this guy, Curt Rounazoin, speak. I said, I know him from the paper that I cite all the time. But what she found was a very normalizing voice for dissociative experiences and the validation of something we teach all the time now, which is that calm, safe place, this thing we ask people to do, is a way we're asking them to dissociate.
Correct.
I mean, it is adaptive for many, maladaptive for some. But even hearing you say that, I'm like, yeah, this guy gets it. This is wonderful.
As you know, when EMDR was starting, dissociative process was seen as a maladaptive thing. It was a defense. It was something that had to be done away with. And I even hear today of therapies that say, well, if you dissociate, you cannot come to my therapy if you dissociate. And my attitude is, please do. because that's a memory network. EMDR, dissociative process, is a memory network, and we always honor the memory network. We honor the defenses. The old analysts had an interesting axiom. They would say, surface before depth, defense before impulse.
Nice.
That you dealt with the surface issues before the deep ones, and you dealt with the defense structures that protected the impulse, the deeper things. You honored them by acknowledging them, and part of what we do in EMDR therapy, and we work, as you know, with the dissociative process, is we honor it because it serves as a survival skill. We don't try to get rid of it. We try to help utilize it.
Right.
And the safe place is a dissociative exercise.
And it's all developed for some protective purpose, for some good reason.
Right.
And it's, to me, grist for the mill.
Right.
And learning the story of the different threads.
Yeah. It used to be there's us that's normal and them that's dissociative. And as you well know, the continuum all depends upon how much trauma has been experienced in life. Over here, we all dissociate, as I shared, all the time. It's built in. Harry Stack Solomon was the very first one to say there's two defense mechanisms, selective inattention and dissociation.
Yes.
And when you get over to this end of the continuum, it simply means there's been more trauma and more reason to utilize it to escape the pain.
Incredibly well put.
Thank you.
And very simple. So tell me, because I know even at this conference there were some things said about the relationship not being that important. What have you learned in your career, really not even specific to dissociation, about the role of the therapeutic relationship in EMDR therapy?
EMDR, well, you being a trainer in EMDR, you know that the people that utilize EMDR the best are good clinicians before they take the training. I actually did a workshop many years ago at ISTSS, and there was a panel, and it was about the role of relationship in the treatment of trauma. And we had all these different representatives of different approaches, and I was EMDR. And ironically, as I look back on that, I was the only one that spoke about relationship. Everybody else was talking about the computer, virtual reality, the manuals. And EMDR deals with relationship. If you don't have relationship, then you're not going to be that safe place for that client to come into. And safety is necessary to tell the story. The good news about what we do, they don't need to tell the story.
Right.
But the safe place allows them to reprocess the trauma. And being in present, being able to witness, I tell my patients that much of what I'm doing, we're going on a journey. It's their journey. I haven't been down this particular road, but I've been down a lot of roads. And I'm going to be a co-journey person with you. And we'll go as, I'll never let you go any place I can't get you out of. And create that sense of safety and relationship. Sometimes, as you know, the therapist is the first safe person they've ever experienced. And we use ourselves as a resource all the time.
Right.
And if we don't have that, then can you do EMDR mechanically? Yeah, but that's never how it was intended.
Yeah.
The role of relationship is so intense. And when you deal with trauma, you have to be in that relationship with that client for that healing to occur. It occurs at such a deep level. We're really triggering, I think, mirror neurons that were never triggered. And we're creating that space. And that's what we should be doing with our most distressed and traumatized patients.
Very well put.
Thank you.
Thank you for taking some time to talk to me.
My pleasure.
There's so much gold even in this little bit of time we spent together. And thanks to all of you for listening in on this conversation.
Thank you for having me.